So today we will be starting with a new chapter, that is your endocrine physiology. So starting from endocrine physiology, you already know these things in your class 12, okay? That will be very easy for you to understand. So we will be moving forward very quickly. Okay, so start. Endocrine physiology means we will be discussing about the hormones, okay? So to know about the hormones, you have to know about two main things, that is your hypothalamus, arekta ki, and your pituitary, okay? So they are situated in specific areas, protected areas, okay? Hypothalamus is situated in কোথায় থাকে অ্যানাটমিতে হেড অন নেক শুরু হয়েছে hypothalamus is by its name it's evident that it's present just below the thalamus in the base of the brain, so it is present in the base of the brain just below thalamus, okay? নামটা দেখো hypothalamus, okay? Next is pituitary. Pituitary is a very protected gland, okay? It actually will be remaining below the hypothalamus with a connecting stalk, that is called as pituitary stalk, and it is present inside a bony cavity in the bone of sphenoid. ওই ক্যাভিটিটার নাম কি? Sella Turcica, that you all know. So that is the basic positioning of these things, okay? So what they do? They actually regulate the total hormonal control of our body. Next, so that is Sella Turcica. So Sella Turcica, pituitary stalk. Sella Turcica কোথায় থাকে? In the sphenoid bone, okay? Sphenoid. So if any short note comes, তোমাকে তো লিখতে হবে, you have to write the positioning of them as well. So ছোট করে বলে দিলাম, in anatomy you will know in great details, of course তোমাদের head and neck যখন হবে you will know all these things, okay? Next, তো একজন দাঁড়িয়ে গেছে, নেক্সট টাইম থেকে কান ধরবে, ঠিক আছে? নেক্সট টাইম যে দাঁড়াবে কান ধরতে হবে। নেক্সট চলো। সো ফার্দারমোর, সো হোয়াট ইজ দ্য বেসিক থিং, হোয়াট ইজ দ্য বেসিক পাথওয়ে অফ দিস থিংস? সো ফার্স্ট ইজ hypothalamus. Hypothalamus will be releasing actually mainly the releasing factors. It directly release some hormones, but their main function is releasing the releasing factors. Releasing factors, okay? Like one example of them are actually your, suppose take thyrotrophin, TRH, thyrotrophin releasing hormone. So here it comes and they will be releasing thyrotrophin releasing hormone, then this goes into your anterior pituitary. From there on, দেখেছো কি সুন্দর শান্ত হয়ে গেল, very good, এই বসে পড়ো। But from next time on, কান ধরে, ঠিক আছে? So TRH, then anterior pituitary. So anterior pituitary में এখানে কি হবে? In case of anterior pituitary, these releasing factors will be releasing some trophic hormones. They are called trophic hormones. Why trophic? Because they will be targeting some glands and they will go accordingly. So এই যে নাম কি? Thyrotrophin releasing hormone. তাহলে এরা কোথায় যাবে? Thyroid gland. Very good. Thyroid gland. So they will go into the thyroid gland, and এখান থেকে তাহলে কোন ট্রফিক হরমোন রিলিজ হবে? TSH, thyroid stimulating hormone, okay? So releasing hormone, they are getting there. This is the trophic hormone which is released, that will stimulate the thyroid gland, and finally here on the final products will be released, that is your FT3, FT4. So that is a one example. Like this, there are several pathways, several hormones. We will be discussing it one by one through 3 episodes, not episodes, 3 classes, 3, 4, 5 classes, okay? So one Monday, HOD sir will be discussing the most important thing, pancreatic hormone. He will teach you. All the other things I will be. So FT3, FT4, okay? So that is from thyroid gland. So that is your target gland, and that is your peripheral hormones, the end products. So that is the basic pathway, that is the basic funda of these two organs. Just like that, এরকম ভাবে আমরা সমস্ত হরমোনগুলো ডিসকাস করব, okay? So first think about hypothalamus. Let's start with hypothalamus. So hypothalamus, okay, will be releasing some hormones which are either positively affecting or negatively affecting. So the positively affecting hormones released by hypothalamus are actually in number 4 চারটে আছে কি কি আছে একটা অলরেডি লিখেছি থাইরোট্রপিন রিলিজিং হরমোন সেকেন্ড ইজ বলো গোনাডোট্রপিন রিলিজিং হরমোন ভেরি গুড থার্ড উইল বি খুব ইম্পর্টেন্ট জি দিয়েই জিএন নয় দ্যাট ইজ GHRH কি এটা গ্রোথ হরমোন রিলিজিং হরমোন গুড নেক্সট ফাইনালি আরেকটা আছে যেটা হচ্ছে CRH কি হবে সি দিয়ে কর্টিকোট্রফিন রিলিজিং কর্টিকোট্রফিন ওকে কর্টিকোট্রফিন থাইরোট্রফিন corticotrophin gonadotrophin okay they are named such as gonadotrophin this is growth hormone so they are releasing hormones then they will be getting into pituitary and then the trophic hormone will be released okay so they are trophins and those released by them or stimulated by them are trophic hormones okay they are trophins that's why they are called trophins হয়ে গেল so now what does this stimulate একটু এখানে আমরা জেনে নি so they will go into the anterior pituitary and they will release what hormones একটু আমরা এখানে লিস্টটা দেখে নি so TRH বুঝতেই পারছো এগুলো কি করবে পিটুইটারিতে TSH but another very important thing that is your prolactin very important prolactin okay the name doesn't match but it will be there next gonadotropin releasing hormone এটা কি রিলিজ করবে বলো এটা তোমরা সবাই জানো very good FSH and LH next growth hormone releasing hormone that is very easy that is your not simple growth hormone আরেকটা নাম কি somatotrophin okay trophic hormones and somatostatin is the inhibiting static means to stop okay so statin is a releasing hormone somatostatin okay নামগুলো এভাবে রিলেট করবে it will be easier and next corticotropin releasing hormone এটা তোমরা সবাই জানো কি রিলিজ করবে ACTH adenocorticotropic right so trophic so ACTH okay so these are positively affecting they are releasing this so they are all positively affecting but there are also two very important negatively affecting hormones as well so negatively affecting hormone ta ki they are in 2 in numbers okay দুটো নাম্বার হয় অলসো কি দুটো হয় সেই দুটো নাম হচ্ছে একটা হচ্ছে প্রোল্যাকটিন যেটা থাকে প্রোল্যাকটিন ইনহিবিটিং হরমোন লাইক PIH another name of this hormone is prolactin inhibiting factor prolactin inhibiting hormone or prolactin inhibiting factor you will be very surprised to know this is nothing but our dopamine okay this is nothing but our dopamine very interesting next PIH হয়ে গেল then another inhibiting hormone will be there that will be your এই যে growth hormone so growth hormone inhibiting that is একটু আগে কি বলছিলাম নামটা somatostatin yeah so growth hormone inhibiting hormone that is your somatostatin next another two things they will be released from hypothalamus but they are stored in pituitary specifically in posterior pituitary they will be stored in posterior pituitary but released from hypothalamus you all know these things antidiuretic hormone another name of this is vasopressin and another thing is antidiuretic আর কি ছিল বলো very good oxytocin so these two things are also don't forget it is also released from hypothalamus but they are gone and they are stored from posterior pituitary so don't tell যদি examiner জিজ্ঞেস করে don't tell him that they are synthesized by posterior pituitary no they are synthesized by hypothalamus technically posterior pituitary doesn't synthesize any hormone at all they are only stored and release they will only store and release okay their only function is to store these hormones and to release these hormones but the synthesis will be coming from hypothalamus only so this is the hypothalamus in case of hypothalamus not much is needed at your age okay পরে তোমরা ডিটেইলে in case of surgery in case of general medicine you will be studying in details Now we'll be focusing upon the pituitary hormones. Okay, first these two hormones are stored hormones and released hormones, so they will be also discussed under posterior pituitary, but we'll be starting from anterior pituitary. Okay, so anterior pituitary hormones and posterior pituitary hormones, so they will be starting from there. So now pituitary location already you know. Okay, so next after location there are two kind of cells. Histopathologically there are two kind of cells in case of pituitary. These two cells will be releasing 6 hormones. Okay, one type of cell, they will be releasing 2 hormones that they are similar and they are called twin hormones. Okay, first kind of cells are acidophilic cells. In histopathology they come as pinkish in color. এটা তোমাদের এক্ষুনি লাগবে না, ইন কেস অফ প্যাথোলজি পরে তোমাদের লাগবে, জাস্ট জেনে রাখো, কোনো বইতে লেখা ছিল বলে লিখে দিলাম। সো অ্যাসিডোফিলিক সেলস, ওকে, দে উইল বি রিলিজিং ইয়োর twin hormones. These twin hormones are your growth hormone and prolactin. Why they are called twin hormones? Because they actually act simultaneously. Prolactin, they actually act simultaneously. That means increase in growth hormone will be increasing your prolactin as well. Decrease in another one, decrease in any one of them will be decreasing the another one as well. The other hormones doesn't show this kind of synchronization. So they are synchronized, their action is also synchronized. So they are called as, though that action is completely different from each other, but they are dependent upon each other. Not really dependent, they actually are synchronized. Release of growth hormone, decrease in growth hormone will be decreasing prolactin and vice versa. Also increase in those hormone will be increasing the other hormone. That's why they are called twin hormones. Okay, they show the similar characteristics. So these two are from acidophilic cells. And so anterior pituitary, this is under anterior pituitary. All the hormone we will be discussing now are from anterior pituitary. Okay, anterior pituitary. So today we will be discussing the anterior pituitary hormones. Acidophilic cells, pinkish in histopathology, growth hormone and prolactin hormone. They are also called twin hormones. Secondarily, another kind of cell is there, that is your acidophilic cell holo arekta cell ki hobe, basophilic cells. So remaining 4, okay, remaining 4 will be released from the basophilic cells. Okay, এদের নামগুলো এবার বলো দেখি এক এক করে, যেগুলো ওইখানে লেখা ছিল, TSH, ACTH, আর কি FSH আর LH. So this is the basic of it. Ever some extra things, that is your hypothalamus and that is your pituitary. So in between them there is a connection. Okay, so pituitary has another name that is called also as hypophysis. Yes, hypophysis. So the anterior pituitary is called as adenohypophysis, and this is your anterior for adeno. Okay, and posterior pituitary will be called as neurohypophysis. That will be called as neurohypophysis. So pituitary, anterior pituitary, A for adenohypophysis, posterior pituitary, that is called neurohypophysis. Okay, so এই টার্মটা তোমরা জানলে। এন্ড তাহলে বলো এই মাঝে স্টকটার নাম কি হবে? hypophyseal tract. This is hypophysis, right? So this connection between them is called as hypothalamo, coming from hypothalamus, so hypothalamo, going into hypophysis, so hypophyseal tract. ম্যাডাম নার্সিং খাতাটা ওখানে দিয়ে দিয়েছি, ওটা কি আমি নিয়ে যাব? So that is your hypothalamo hypophyseal tract. Okay, so this is the basis of it. এগুলো extra information examiner may ask, and also you can write in your exams as well. Okay, so another important thing is there are some cells also. Okay, these two cells are mainly responsible for the release of this hormone, but there are also other kind of cells, that is your corticotrophic cells. Corticotrophic cells are also there. Another kind of cells you can find in your pituitary, specifically anterior pituitary. Okay, so now these corticotrophic cells are actually having a precursor. They have a precursor that is named as, লেখো এটা ভালো করে, POMC. POMC. Pre means, P means pre, O means opio. Pre opio. M for, M is related to melanocyte, so that is called melano. And C for cortin. So this is a precursor cell of corticotrophic cells. Okay, that is called as POMC cells. So this is a precursor of corticotrophic cells. The precursor means these cells are coming from POMC. Okay, precursor. দেখো precursor, so that's why এখানে pre শব্দটা আছে। pre opio melano cortin. So opio endorphin বলে একটা হরমোন হয়, that is released from these cells. Okay, endorphins. Next melano. So melanocyte কি রিলিজ করবে? MSH, melanocyte releasing hormone. Responsible for color or of an individual, color of skin of an individual. Okay, and cortin, that is actually, cortin এর নামটা শুনে বুঝতে পারছো কাকে করবে এফেক্ট? ACTH. Okay, so these are precursors. When this cell was present, it was releasing these hormones. Finally the precursor converts into corticotrophic cells. Okay, these corticotrophic cells is also present in anterior pituitary, but now these things will be released by basophilic cells. Okay, so corticotrophic cells, they have an precursor. When it was precursor, it was releasing these hormones. Opio means endorphins. Okay, melano means melanocyte releasing hormone, ওখান থেকে ওটা বের হয়। So these are precursor. So বোঝা গেল, this is precursor of all the things. Okay, endorphins, melanocyte releasing hormone, it had all the components. Then the components get detached and specified হয়ে কি হলো? বেসোফিলিক সেল হলো, যেটা এটাকে নিয়ে গেল। মেলানোসাইট রিলিজিং হরমোন আলাদা জায়গায় চলে গেল, সেটা আমরা পরে দেখব। অ্যান্ড ACTH এই যে এখানে চলে এলো। ওকে, সো দ্যাটস হাউ ইটস ডিভাইডেড। সো দ্যাট ইজ অলসো অ্যানাদার ইনফরমেশন। ইফ এনিওয়ান আস্কস হোয়াট ইজ corticotrophic cells and about it, you can write it. নর্মালি এটা নিয়ে খুব একটা কোশ্চেন আসে না। Pre-opio melanocortin, POMC. This is precursor cell of corticotrophic cells, which is also present in anterior pituitary. But only 2 cells are necessary for release in a normal person, in an adult person. Okay, basophilic cells, adult bolbo na, after birth. Basophilic cells and your acidophilic cells. So now we'll be discussing in details the releasing hormones from acidophilic cells. 2 hormones we'll be discussing today. That is our twin hormone. Those are prolactin and our growth hormone. So let's get into it. First start with growth hormone. Growth hormone দিয়ে আমরা জিনিসটা শুরু করি। ওকে, ও অফকোর্স another thing I forgot, যদি ওটা পরে বললেও হয়, পরেও এমনিতেও বলতে হবে। So from posterior pituitary, okay, 2 hormones I already talked about, that was stored and released, that was called as ADH and another was oxytocin. ADH and oxytocin. Now you can ask ki sir এরা কোথা থেকে রিলিজ হয় তাহলে? They are not released from posterior pituitary, right? So they are released from this ADH, it will be released from paraventricular cells. লেখো, sorry, ADH will be released from supraoptic cells. ADH will be released from supraoptic cells, and this oxytocin, that is released from paraventricular cells. They are being released from these cells, paraventricular cells. They are being released from these cells. They come into posterior pituitary. They are stored and they are finally released. So I would have already told you when we will be studying the ADH and oxytocin. Just এখানে লেখা ছিল, তো আমার মনে হলো বলে দিই। Okay, so that is it. এটা জাস্ট এমনি বলে দিলাম। Next, let's move on to our growth hormone. Growth hormone এখানে কি আছে? Anterior pituitary এর মধ্যে আমরা কেবলমাত্র anterior pituitary acidophilic cells এর two hormones that we will study today, that is growth hormone and prolactin. So growth hormone is the most abundant, okay, and also very important, growth hormone is released from your acidophilic cells, and also acidophilic cells এর মধ্যে সেগুলোকে আমরা কি বলছি, since they are releasing somatotrophs, so they will be called as, those cells will be called as somatotrophs. Okay, most abundant hormone in anterior pituitary, released from cells also called as somatotrophs. These somatotrophs are 50% of all the available cells, 50% of all the cells of anterior pituitary. 50% শুধু somatotrophs থাকে, all the other things that will be released from the other 50% cells. 50% of them are somatotrophs, 50% of anterior pituitary cells release this growth hormone. That's why this is most abundant, সবচেয়ে বেশি সেল রিলিজ করছে, that's why this is most abundant. Okay, so these things you have to know. And next is your factors, specific factors that they actually vary. This growth hormone varies with age. কোন বয়সে সবচেয়ে বেশি রিলিজ হবে? In adolescence, ছোটবেলা যখন আমাদের মেইনলি গ্রোথটা হয়, when we actually grow, that means in adolescence, GH release is much higher, that means maximum. And finally, in case of old age, geriatric age, এটাকে আমরা আরেকটা নাম বলছি senile person বলি, তো ওটাকে আমরা বলি senescence. In case of old age or senescence, okay, তোমরা old age ই লিখবে বা senescence ও লিখতে পারো, স্পেলিং যদি মনে থাকে, ঠিক আছে, অনেকে স্পেলিং ভুল লিখলে নাম্বার কেটে দেয় আবার। So in that case, growth hormone will be released very minimal amount. So the minimum release of growth hormone is in old age. Okay, so that is some factor you have to know. Next, এবারে আমরা রেগুলেশনে চলে যাব। ওকে, সো রিলিজ ফ্রম দিস সেলস, ওকে, varies with age. So basic characteristics we have already known. Now we will be moving on to directly regulation of your growth hormones. Regulation কিভাবে হবে সেটা আমরা ডিসকাস করব। Regulation of growth hormone, লেখো hypothalamus, পুরোটা তোমরা লিখবে, আমি শর্টে লিখছি hypothalamus. Then hypothalamus, from here কি রিলিজ হচ্ছে, একটা হচ্ছে গ্রোথ হরমোন রিলিজিং হরমোন, আর একটা কি রিলিজ হচ্ছে somatostatin. Okay, so they both are coming into কোথায় আসছে, anterior pituitary. They are both coming into anterior pituitary. Now tell me, GHRH will positively affect, তাই তো, and somatostatin will negatively affect. So first of all, the first round of regulation comes from there. Okay, GHRH, growth hormone releasing hormone, will be positively affecting anterior pituitary to make them release your কি রিলিজ করে, growth hormone, and somatostatin will be negatively affecting anterior pituitary to inhibit the release of growth hormone. So দেখো, এটা নেগেটিভলি এফেক্ট করছে, এটা পজিটিভলি এফেক্ট করছে. So this is the first round of regulation. Okay, now another round of regulation is, now this growth hormone, okay, usually body সমস্ত জায়গায় যায়, it goes into the every area of our body, now this growth hormone has direct actions and they also have their indirect actions. Now this indirect action is very important because here on comes another portion of their regulation. So this indirect action of growth hormone comes via liver. They go into the liver. They go into the liver. They will go into liver, and ekhane in here another thing is, you will get another thing that is called as IGF, insulin like growth factor 1. That is, you can say, a similar thing as growth hormone. Okay, so it acts exactly as a growth hormone. It acts as also insulin like. So insulin like growth factor, it acts as insulin, it acts as growth hormone. Okay, insulin like growth factor IGF-1, it is found in liver. So this is the indirect action. This IGF-1 will perform the indirect action. So this indirect action of growth hormone is via liver, formation of this IGF-1, and direct action সেগুলো আমরা পরে দেখব. 3-4 direct actions are there. Okay, and this is indirect action. So this is another regulation. কেন? This IGF-1, they will negatively affect hypothalamus, and they will direct action টা মুছে দিই, and they will negatively affect. So direct action of GH is already proliferating your body and all, সেগুলো আমরা পরে দেখব অ্যাকশনে. But indirect action is formation of IGF-1, insulin like growth factor 1 in liver. Okay, so now when this IGF-1 will be too much negative, তো ওরা বুঝবে, they will understand that there is very increased release of growth hormone. Okay, so they will negatively affect both the anterior pituitary and both the hypothalamus. Okay, so somatostatin and IGF-1, they are negatively inhibiting your growth hormone release, but this GHRH or hypothalamus itself, they are positively affecting our growth hormone release. So that is the basic regulation. That is the basic regulation pathway. সেজন্য আমি একবারে লিখলাম. That is very easy to understand now. এমন কিছু কঠিন নয়. If I would have written in words, then it would have been hectic. But is picture দিয়ে করবে, that will be very easy. Every hormone regulation you should study and prepare with a picture. One picture is enough to remember everything. Okay, rather than words. So next, that is the basic regulation. তো নেক্সট হচ্ছে গিয়ে ড্রাগ ফর্ম. একটা জিনিস এখানে মনে রাখবে, গ্রোথ হরমোনের যে ড্রাগ ফর্ম আছে, সো ড্রাগ ফর্মগুলো কিভাবে ইউজ করি? গ্রোথ হরমোন রিলিজিং হরমোন, সো দিস GHRH, ওকে, ড্রাগ ফর্ম পাওয়া যায়. দিস ড্রাগ ইজ ইউজড ইন, দেখা যাচ্ছে না, সো দিস ড্রাগ ফর্ম ইজ ইউজড ইন কেস অফ ডোয়ার্ফিজম অ্যান্ড অল. ওগুলো আমরা পরে আবার বলবো, বাট এখানে একবার বলে দিই যেহেতু লেখা আছে. সো ডার্ক ফর্ম আর সোমাটোস্ট্যাটিনেরও একটা ডার্ক ফর্ম পাওয়া যায়. ওকে, সোমাটোস্ট্যাটিন অলসো হ্যাজ ডার্ক ফর্ম, দ্যাট ইজ ক্লিনিক্যাল. This is clinical significance. Okay, clinical significance is this GHRH has drug form. If you provide this drug form, they will positively affect the GH release. Okay, so in case of any disease, in case of any treatment of growth hormone deficiency, আমরা এই ডার্ক ফর্মটা দিই. We provide this dark form of GHRH, and in case of acromegaly or in case of gigantism, we provide, already তোমরা acromegaly gigantism জানো, আমরা অলরেডি বলবো, বাট 11-12 এগুলো জেনে এসছো. ওকে, এই বলো acromegaly কাদের হয়? হ্যাঁ, কাদের হয়? at old age নয়, adult age. ওকে, and বাচ্চাদের কি হয়? gigantism. Very good. So এই হচ্ছে ব্যাপার. So in case of either treatment of acromegaly or either in treatment of your gigantism, আমরা এটা ডার্ক ফর্ম ইউজ করতে পারি. So since we are talking about regulation, আমরা এখানে ওরা যেখান থেকে আমি তৈরি করেছি ওখানে ওটা এখানে একবার লেখা ছিল. So this dark form can be used in acromegaly or gigantism. This dark form can be used in, ও এইভাবেই সুভাষিস স্যার জিজ্ঞেস করে মাঝে মাঝে নাকি, আগের দিন আমায় দুজন স্টুডেন্ট বলে দিয়েছে, আমি ওটাই ইউজ করছি. গুড, ওই জন্য তোমরা খুব খুশি হও আমি এলে, আমি জানি, কারণ আমি কিছু জিজ্ঞেস করি না, জিজ্ঞেস করতে হবে মাঝে মাঝে. ওকে, সো দিস ডার্ক ফর্ম ইজ কল্ড অ্যাজ, লেখো, সারমোরেলিন. Sarmorelin. Okay, this is a dark form of your growth hormone release. Sarmorelin, ACRMORELIN. Sarmorelin. that is dark form of GHRH, and dark form of somatostatin is will be called octreotide, OCTREO, octreotide, TIDE. So they can also regulate, but they are not natural, they are synthesized as a dark form, and in case of diseases, in case of specific treatments, if you see any kind of deficiency or overactivity, you can use them, okay, as a medicine এবং officially দেওয়া হয়, ঠিক আছে? So sermorelin in case of pituitary dwarfism, and this octreotide in case of gigantism or acromegaly. So that is the total regulation. এটা তোমরা নাও লিখতে পারো, but this thing in case of regulation, this you have to completely say all of these things. You will write the table, write the chart, and also explain by your words. ছোট ছোট করে word explain করবে in brief points, and it will you will get perfect marks, okay? So next factors. So this is the regulation. Now we will be moving into factors which increase or decrease your growth hormone release, okay? Sermorelin লিখে নাও, ACRMORELIN মুছে দিলাম. So now write factors increasing your growth hormone release. কি কি হয়? Which are the factors that increase growth hormone release? Next point. This comes under regulation as well, okay? That is the structural regulation, okay? They are regulated by the structures, and there are specific factors. Other than these things, there can be also other factors which affect this regulation either positively or negatively. So those factors increasing, okay, তোমরা কিন্তু পরীক্ষায় এইসব ইউজ করবে না, তোমরা পুরো ওয়ার্ড লিখবে, okay? Factors increasing GH release. What are the factors that can increase GH release? লেখো, low blood glucose first. Low blood glucose, very important, very important. Low blood glucose will always be increasing your growth hormone release, okay? This phenomena is called, এটাকে কি বলে? Hypoglycemia. So either low blood glucose, hypoglycemia is the condition which can precipitate increased growth hormone release. Second is your হচ্ছে গিয়ে তোমার আরো আছে এখানে fasting. So when you are fasting, your body will be using your available blood glucose, so ultimately your blood glucose level will be low. Third, fasting হয়ে গেল. Then starvation. In case of starvation, okay, your reserve is done, you are not eating anything new for a long period of time, so your blood will have very low amount of glucose. So that is also hypoglycemic state, and that will increase your growth hormone release. 3, exercise. When you are exercising, your body has increased demand of insulin or increased demand of sugar. Increased sugar use in your cells, okay, happen during exercises or vigorous activities. So this will also increase your growth hormone release. So these are all related to your blood glucose levels, okay? Next, finally, in case of sleep, okay, in case of sleep দু রকম হয়, REM sleep, okay, rapid eye movement sleep and NREM sleep. So in case of sleep, in case of NREM sleep, so when you are rapid REM sleep মানে কি? Rapid eye movement sleep. So when we are doing rapid eye movement, that means our sleep is not deep, okay? Usually in case of যখন আমরা সবে সবে ঘুমাতে শুরু করি, when we start, okay, or during when our eye almost opens, okay, we have rested for quite amount of time, then our sleep becomes a little bit lighter. So that is your REM sleep. That's when our eye movements, our eyeball movements are very rapid. সেখান থেকেই নামটা দিয়েছে REM sleep. REM sleep তার মানে কি? যখনই তোমার rapid eye movement হবে, whenever you are having rapid eye movement, that means your sleep is not deep. That's why your eye is moving frantically. You are just not waking up, but your sleep becomes very much lighter. But NREM is deep sleep, okay? Easy to understand now? So in case of NREM sleep মানে deep sleep, during deep sleep state your growth hormone release also increases. That's why বলে বাচ্চাদেরকে in case of children or in case of every person, okay, good growth, good physical growth is also important, okay, and also dependent upon if the person is eating adequately, if the person is sleeping adequately. Now you can understand, you can ask কি স্যার আমি যদি না খাই আমার যদি ব্লাড গ্লুকোজ লো থাকে তাহলে তো আমার বেশি রিলিজ হবে। It's not really like that, okay. Low blood glucose can precipitate this increased growth hormone release for just some time, but usually তুমি যদি ভালো করে না খাও, if you don't provide nutrients in your body, automatically তোমার growth inhibit হবেই, okay. So that is another factor. Fasting and starvation, they can only increase growth hormone release for sustained amount of time, but long amount of time তুমি যদি low blood glucose রাখো, your growth will be hampered because your cells will not act properly না, cells গুলোকে act করার জন্য একটা positive loop হয়ে যাবে। So you are not eating, your growth hormone is primarily releasing, but then your cells, the growth hormone release করার জন্য তো কিছু সেলকে কাজ করতে লাগবে, that activity will be hampered because you are not eating properly, your nutrients are not working properly. So এভাবে একটা লুপের মধ্যে ফেসে যাবে, okay. Your growth hormone will increase but they will be not be effectively working, okay, in long term. So long term fasting, starvation will ultimately hamper your growth, though momentarily they can increase growth hormone release, but exercise, good sleep, deep sleep, they are long term enhancements of growth hormone release. বোঝা গেল? এইগুলো বাচ্চাদের করা খুব দরকার বাচ্চা বয়স থেকে। the babies and children, okay, physically active থাকবে, ভালো করে খাবে, ভালো করে ঘুমাবে, so that তাহলে ওদের physical growth বেশি হবে। now every person has different kind of growth, but the optimal growth of that particular person, not everybody will be 6 feet longer, not everybody will be big boned and all, but the optimal growth for that person will be responsible if you do perfect exercise, if you make the baby physically active. এখনকার বাচ্চারা মোবাইল নিয়ে বসছে, ওরকম করলে হবে না, ঠিক আছে। ভালো করে ঘুমাতে হবে, ভালো করে খাওয়া দাওয়া করতে হবে, ভালো করে physically active থাকতে হবে, they need to play, they need to do physical activities well. Finally number 5 এ আছে তোমার stress. In case of stress also your hypoglycemia can persist. In case of stress, your body cells, your body is actually stressed, they are taking up more blood glucose for activity, and stress can also, just like that, stress can momentarily, they are all momentarily increasing growth hormone at that moment, okay, temporarily or momentarily, but long term এর জন্য এইগুলো আমার important. These factors increase growth hormone release. নাও আমাদেরকে চলে যেতে হবে, ইনক্রিজ করেছিল তাহলে আমাদের ডিক্রিজ করাতে চলে যেতে হবে। লেখো factors which decrease your growth hormone release. Decrease কে করবে? If low blood glucose is increasing, then high blood glucose will be decreased. So decreasing growth hormone, that factors are first এটার টার্মটা কি? হাইপারগ্লাইসেমিয়া। Okay, the mechanism behind this is, remember that insulin like growth factor 1, okay, কি করছিল ওখানে রেগুলেশনে, that was going and negatively affecting all the things, okay. In liver, that growth hormone was releasing this IGF-1, ঠিক আছে। So increased amount of blood glucose, okay, that will inhibit the insulin like growth factor, এটা বেড়ে যাবে, IGF will increase and IGF will then affect this growth hormone negatively, okay. So increased blood glucose, in this way they will be inhibiting your growth hormone. Second, increased blood glucose যদি inhibit করে, next আরেকটা আমরা অলরেডি তোমরা জানো কি, somatostatin. Somatostatin released from that hypothalamus 3 your IGF-1, অলরেডি আমি বলেছি নেগেটিভলি, ওই যে এখানে ছিল এরকম ভাবে এরকম এঁকেছিলাম IGF-1. নেক্সট 4 is your, একটু আগেই বললাম NREM sleep or deep sleep will be increasing your growth hormone release, but decrease sleep, not decrease বলবো, light sleep or REM sleep or REM, rapid eye movement, REM sleep will be decreasing your growth hormone release. So এবার তুমি ভেবে দেখো যে বাচ্চারা ওবেজ হয়, ওবেজ বেবিস, ওকে, they will not have their good growth hormone release, ওকে, ওদের কিন্তু growth hormone release inhibit হয়ে যাবে, so baby ওবেজ হলে হবে না, ওকে, and also এই ফ্যাক্টর গুলোও আছে, these factors will also inhibit growth hormone release, IGF-1, somatostatin and light sleep means REM sleep, rapid eye movement sleep, that will be negatively affecting your growth hormone release. So that's all about your regulation of growth hormone, structural regulation and functional regulation by these actions. ঠিক আছে, so that is your regulation. Regulation এর পরে আমরা নরমালি কোথায় যাই? Function. So now write functions of growth hormone. লেখো function of growth hormone. Function of growth hormone. What are the functions? First function is, of course, to function, okay, they will must need some receptors. তো ছোট করে এখানে একটা পয়েন্ট লেখো, receptors. These receptors of growth hormone are a type of cytokine receptors. Cytokine receptors. Cytokine receptors, and finally it is these cytokine receptors after growth hormone released and they get into the cytokine receptors, they actually activate a certain enzyme. আরেকটা জিনিস আমি বলতে ভুলে গেছি, এই একটু ওখানে অ্যাড করো তো, এইখানে এই তোমার অ্যাক্টিভেশনে ওইখানে হাইপোথ্যালামাস ছিল, সেখানে পিটুইটারি, আফটার হাইপোথ্যালামাস দ্যাট ওয়াজ পিটুইটারি, আই ফরগট ওয়ান থিং, হাইপোথ্যালামাস পিটুইটারি, ওকে, সেখান থেকে আমরা যখন রিলিজ করছিলাম, এখানে একটা ছোট করে সাইডে পয়েন্ট অ্যাড করো, রেগুলেশনের ওই টেবিলটা, গ্রেলিন, GHRELIN, ghrelin is a peptide, okay, it is a peptide hormone in stomach, GI তে ছিল, in case of from stomach it is released, okay, it is a peptide hormone released from stomach that will also positively affect your GH release, okay, ওটা বাদিকে একটু অ্যাড করে দাও ছোট করে, ওটা আমি বলতে ভুলে গেছি, ওকে, গ্রেলিন আমার এখন মনে পড়লো রিসেপ্টরের কথায়, দিস গ্রেলিন ওখানে অ্যাড করো, ইট উইল অলসো পজিটিভলি এফেক্ট, এই যে এই ছকটা যেটা ছিল এইখানে একটা সাইডে লেখো গ্রেলিন, দিয়ে ওখানে পজিটিভ একটা প্লাস চিহ্ন দিয়ে এইভাবে লিখে দাও, দ্যাট ইজ অলসো পজিটিভলি এফেক্টিং স্ট্রাকচারালির মধ্যে ওখানে একটা লেখো, ঠিক আছে। নেক্সট cytokine receptors, so these cytokine receptors are actually will be going and they will enhance, not enhance actually, they will, actual termটা হচ্ছে stimulate, they will stimulate your certain enzymes that is called Janus kinase, that is an enzyme which is stimulated by our growth hormone after they are getting into the cytokine receptors, okay, that is called as এই যে pathway, এটাকেই আমরা বলছি Janus kinase pathway. Which other hormone follows this pathway as well? Of course, they are twin hormones, so prolactin will also have Janus kinase pathway activated, okay. So they are this cytokine, after getting into the cytokine receptors, this growth hormone cannot act right now, okay, they will be now stimulating this Janus kinase pathway, and after this Janus kinase enzyme is stimulated, only then they will activate your growth hormone, only then they will activate your growth hormone, and then they will come into your function, okay. So this growth hormone, they are getting into your cytokine receptors, these cytokine receptors will stimulate Janus kinase. Why? Because the growth hormone has received by cytokine receptors, but it is not enough for them to function, they are still not activated, they are only received here, but the activation will only happen when they will go, these receptors, after getting into the receptors, they getting into the receptors, this total incident will stimulate a certain enzyme that is called Janus kinase enzyme, okay, and after the Janus kinase is activated, after the Janus kinase enzyme is activated, stimulated, they will activate, now they will activate the received growth hormone to perform the functions, and this extra pathway, this pathway is called as Janus kinase pathway. ঠিক আছে, so the stimulation of Janus kinase enzyme, okay, and after being stimulated the Janus kinase enzyme going to activate the growth hormone in these receptors, এই যে pathwayটা, this pathway is called Janus kinase pathway. very important question, অনেকবার জিজ্ঞেস করে, ওরালি জিজ্ঞেস করবে, ভার্বালি জিজ্ঞেস করতে পারে, তোমাদের লিখতে দিতে পারে, okay, very important question. So now after they are now properly activated, now get into the functions. লেখো, their functions are, already I have told you, direct functions and indirect functions. So indirect functions, you know, indirect function কি ছিল, getting into the liver, releasing IGF-1, IGF full form কি, insulin like growth factor 1, okay, that was the indirect function. আরেকটা কথা লিখেছিলাম, okay, I wrote that there are some direct function as well. So now they are the direct functions that we will be able to study. এখানে কি আছে, ডাইরেক্ট ফাংশন গুলো কি আছে লেখো। ফার্স্ট হচ্ছে তোমার, so remember function of growth hormone is anti-insulin like, anti-insulin like, they act as insulin like, ইনসুলিনের যে ফাংশন হবে তার অপোজিট করবে, ঠিক আছে। so function of GH is anti-insulin like. Why? Because hypoglycemia was actually increasing the release of growth hormone, okay, and hyperglycemia was decreasing the release of growth hormone, so they are anti-insulin like function, okay. so anti-insulin like function কি কি করবে তাহলে ফাংশন গুলো শিগগির লেখো। লাইপোলাইসিস, first is lipolysis, okay, so function direct. second লেখো বোন ফর্মেশন, লেখো বোন গ্রোথ লেখো, রাইট ডাউন বোন, আমি লিখছি এখানে একসাথে দুটো আছে, আমি করে দিচ্ছি একবার। সেকেন্ড পয়েন্ট লেখো বোন গ্রোথ, so this comes under direct and indirect functions. Indirect first function was release of IGF, ওটা তোমরা অলরেডি IGF-1 release from liver first, okay. second is your bone growth also, এখানেও bone growth হয়, okay, but the bone growth functions are different, okay. so the direct function will only include conversion of লেখো pre-chondrocytes into chondrocytes. So these things in case of osteology, anatomy, তোমরা নিশ্চয়ই এগুলো পড়বে, how the bone is formed. So pre-chondrocytes, from pre-chondrocytes to chondrocyte, this is actually stimulated by as a direct function of GH. Direct function, growth hormone direct function. So that is part of bone growth. So bone growth is the only mechanism which is a result of both direct function and both indirect function, but the mode of acting is different, okay. Direct action includes only the conversion of pre-chondrocytes into chondrocytes, but indirect action of bone growth includes all the other steps of bone formation. All the other steps of bone formation except the conversion of prechondrocytes into chondrocytes, okay. This is direct, all the others are coming under indirect function. Another was IGF-1 release, okay. Specific এটা কি ছিল, lipolysis. Third direct action is your increasing lean mass. Fourth direct action is increase in muscle mass, okay. So it is mostly related to bodily growth, okay. Lipolysis of course very important, lipolysis হবে, bone growth, prechondrocytes to chondrocytes, increase in lean mass, lean body mass, of course এখানে body কথাটা অ্যাড করতে পারো, lean body mass and increase in muscle mass. These are the direct function of growth hormone. and among indirect function IGF-1 release, bone growth, all the other steps except this part, and আর কি আছে আরেকটা আছে অ্যান্টি লাইপোলাইসিস। অফকোর্স লাইপোলাইসিস যদি ওখানে হচ্ছিল এখানে কি করবে অ্যান্টি লাইপোলাইসিস। সো দে প্রিভেন্ট দ্য ইনডাইরেক্ট ফাংশন prevents lipolysis. So the indirect function includes also anti-lipolysis. Okay. But remember, if the direct function was anti-insulin like, then the indirect function will be insulin like function. এগুলো জিজ্ঞেস করতে পারে। This indirect function will include insulin like function. Itself is a very complex hormone. They okay. The direct function is anti-insulin like, the indirect function is insulin like. They can cause lipolysis by direct function, they can cause anti-lipolysis by indirect function. Okay, very confusing hormone, but it does a lot of things. Okay, very important hormone for our body. Okay, very important for regulation. Whenever something is getting more, something is getting less, they can alter that by either direct function or indirect function. Okay, so এইভাবে ওরা এই ফাংশন গুলো লেখো। নেক্সট হচ্ছে ডিসঅর্ডারস। ফাইনালি আমরা পৌঁছে গেছি কিসে ডিসঅর্ডারসে। তো আজকে শুধুমাত্র গ্রোথ হরমোনটাই হবে, পরের দিন আমরা প্রোল্যাক্টিন করব আর বাকিগুলো করব। সো লেখো ডিসঅর্ডারস অলরেডি ইউ নো, রাইট ডাউন। কি জানো লিখে ভালো, দুটো হেডিং দাও, গিভ টু হেডিংস ইন কেস অফ চিলড্রেন অ্যান্ড ইন কেস অফ অ্যাডাল্টস। সো রেগুলেশন কাটো, লেখো disorders. First, adults. Second, children. In case of children, the disorders can be increased release. Increased release will be called as, বাচ্চাদের ক্ষেত্রে কি বলে, gigantism. Second, decreased release, that will be called as dwarfism. In case of adults, okay, increased release, that is called as your নাম কি বলো, acromegaly. Okay, কোন ওষুধটা ইউজ করছিলাম আমরা ওটার জন্য অক্টিওটাইড। ওকে, আর ওটার জন্য সারমোরেলিন পড়বে ওগুলো করে। ওকে, সো অ্যাডাল্টস এন্ড চিলড্রেন, দিস আর দ্য বেসিক ডিসঅর্ডারস। ওকে, সো এখানে একটু এক্সপ্লেন করতে হবে ডিসঅর্ডারস গুলো। সো কি in case of acromegaly often short note comes, so you have to acromegaly ইয়েগুলো লিখতে হবে। What we can see in case of acromegaly, লেখো first is frontal bossing. Frontal bossing due to bony growth, of course insulin, ইনসুলিন বলছি, গ্রোথ হরমোন কি করছিল, রিলি ইনক্রিজ করছিল বনি গ্রোথকে। সো বনি গ্রোথ যদি ইনক্রিজড হয়, there will be frontal bossing. লেখো frontal bossing. Okay, এই মাথার এখানটা, এই যে সামনের দিকে frontal bone, that will be proliferated, frontal bossing. Second, after frontal bossing there will be also increased hand in foot size, increased hand and increased foot size. So all of this is due to over proliferation, right? Increase হয়ে যাচ্ছে, so all of this due to over proliferation. আর কোথায় বাড়তে পারে, increased mandibular enlargement. This mandibles দেখবে মুখের এখানটাও ছবিগুলো দেখবে বড় হয়ে থাকে। So mandibular, all of this due to increased bony growth. Okay, mandibular enhancement. Because remember, bony growth was the only thing, bone growth was the only thing that was precipitated by both direct function and indirect function. There is no inhibition. Okay, so direct function is also increasing the effects, indirect function is also increasing the effects. So that's why all of these things will be increased. Okay, so mandibular enhancement, frontal bossing, hand and foot size hobe increased. Next, increased heel pad thickness. So our heel pad thickness is normal, but in those patients তোমরা দেখবে increased heel pad thickness হবে, and due to increased hand and foot size and due to increased heel pad thickness দেখবে ওদের সাইজে জুতো পাওয়া যায় না, there are very hard, okay, for shoes of acromegaly patients. They actually use custom made shoes. So heel pad thickness, increased heel pad thickness. Next আর কি আছে, there are also other characteristics, that is carpal tunnel syndrome. Why? না প্রত্যেকটার পেছনে explanation আছে, I am going and explaining. Frontal bossing due to overproliferation of frontal bone, hand and foot size is due to overproliferation of these bones, mandibular enhancement is due to overproliferation of mandible, increased heel pad thickness is due to overproliferation of tissues. এগুলো কোন টিস্যু? সফট টিস্যু, overproliferation of soft tissue. So increased hand foot size, that is both due to bone and both due to increased soft tissue. Not only the bony enhancement is there, but also soft tissue enlargement also there. So increased heel pad thickness is due to soft tissue, and carpal tunnel syndrome, that is also due to increased bony growth and increased soft tissue enhancement. carpal tunnel এখানে থাকে, so এখানে যদি bony growth হয়, if there is bony growth and soft tissue enhancement, কি হবে? carpal tunnel এর মধ্যে যে নার্ভ গুলো যাচ্ছে ওগুলো কি হবে? চেপে যাবে, okay, they will be compressed, and this compression will cause ultimately carpal tunnel syndrome. Carpal tunnel syndrome is nothing but the compression of the nervous structures going inside it, so going inside the carpal tunnel, so that's why the carpal tunnel syndrome will be precipitated. Okay, next carpal tunnel syndrome এর পরে হবে sleep apnea, that is also due to increased soft tissue enhancement. Soft tissue enhancement এর জন্য sleep apnea হবে. Why? Because the responsible muscles will be not be able to work properly, because আশেপাশে যে soft tissue ছিল, the soft tissue around them will be compressing them, compress করবে, airway compress হয়ে যাবে, the muscles acting, okay, for respiration, they will be also compressed, okay, তাহলে নিঃশ্বাস নিতে পারবে না, there will be sleep apnea. Next আরেকটা কি বলেছি, they actually increase the level of insulin. Why? Because of insulin like growth factors. So these growth factors will be increasing the insulin level, okay, or they will not directly increase the insulin level, but they will be performing similar activities like insulin. That's why they are called insulin like growth factors. They are not insulin, but they act as insulin, okay, দেখো লেখা আছে এখনো insulin like. So what they will do, they will be increasing your blood glucose level, increase your blood glucose level. That means, that's why এটা ইয়েতে explain হইতে আসতে পারে, why growth hormone is called as diabetogenic hormone. So this hormone is also diabetogenic, they can precipitate diabetes, okay, so they are prone to precipitate diabetes, that's why they are called diabetogenic hormones. So increased blood glucose levels is seen in case of acromegaly patients, that means they are prone to diabetes, they are very high chance to get sick from diabetes, they are prone to diabetes. So these are all the things that you can need. দেখি কিছু মিস হয়ে গেল কিনা, না ঠিক আছে। So this 1 2 3 4 5 6 these 7 are actually typical factors of acromegaly, ঠিক আছে, এটা শর্ট নোট দেয়, ভেরি ইম্পর্টেন্ট শর্ট নোট, তোমরা কোনো ব্যাপার না লিখে দেবে। নেক্সট ট্রিটমেন্ট ইজ ভেরি ইজি, একটুখানি আছে। ট্রিটমেন্ট ইজ either you can do surgery, okay, so surgical resection of microadenoma. Why? This microadenoma was the cause, okay, for microadenoma. This microadenoma was the cause for precipitation of your acromegaly, okay. So surgical resection of microadenoma first. Second হচ্ছে somatostatin আমরা দিতে পারি, already we have discussed somatostatin analogs, that was octreotide. Third is growth hormone receptor antagonist. গ্রোথ হরমোন রিসেপ্টর কি ছিল? সাইটোকাইন রিসেপ্টর। সো আমরা যদি রিসেপ্টরে কিছু ব্লক করে দিই তাহলে কি হবে? গ্রোথ হরমোন উইল নট বি এবল টু, they will come but they will not be able to connect with the receptors. Now if they are not able to connect with the receptors, their actions will be hampered. So growth hormone receptor antagonist. So we can block them at the production level, we can block them at the functional level. Okay, that is production level blockage. Somatostatin analog দিয়ে দিচ্ছি, growth hormone release হচ্ছে না, and their functional level we are blocking the receptor, we are not blocking the analog, we are not blocking the release but we are blocking the receptor itself. Okay, so যে receptor antagonist এটার নাম তোমরা জানো, বারবার লিখছি না, অক্ট্রিওটাইড। এটার একটা নাম আছে, সেটার নাম হচ্ছে লেখো রেগনিসোম্যান্ট, পেগনি SOMANT, পেগনিসোম্যান্ট, PGNISOMANT, পেগনিসোম্যান্ট। ওকে, সো দ্যাট ইজ ইয়োর ট্রিটমেন্ট অফ অ্যাক্রোমেগালি, ট্রিটমেন্ট অফ অ্যাক্রোমেগালি। নাও আর একটা ছোট 2 লাইন বাকি আছে, ওটা পরের দিন বলে দেবো, পরের স্যারের দেরি হয়ে যাচ্ছে। There is a special type of dwarfism also where the receptor problem is there. Just like I said, if there is any problem in receptor level তাহলেও কিন্তু আমার গ্রোথ হরমোন কাজ করতে পারবে না। Okay, so in some patients you can see that the growth hormone is very much okay, they are not limited but the receptor is problematic. Okay, ওখানে একটা আছে ল্যারেন্স বলে, ওটা পরের দিন বলে দেবো।